Some things are. Dr. Scott Adzick is aware of this more than any of us will ever be. He is the surgeon in chief at the Children's Hospital of Philadelphia. He's been on with us before. He's talking to us about fetal surgery and how it can save and improve the lives of children worldwide. January, by the way, is Birth Effects Awareness Month. Dr. Scott Adzick, good morning, doctor. How are you?
Good morning to you.
It's amazing what you can do. How often does this happen? How often does an unborn baby need surgery?
Well, to put it in perspective, this year we'll evaluate close to 2,000 women carrying babies with birth defects, and these women come from all around the United States and outside the U.S. We'll do about 200 fetal surgery operations, so about roughly 10% of the patients we see, that is mothers carrying babies with birth defects, need an operation before birth. Most can simply have the pregnancy followed, be delivered in a place like our special delivery unit at the Children's Hospital of Philadephia, and be treated after birth. It is only those birth defects that cause progressive organ damage before birth where it might make sense to fix them before birth.
Is there a way to explain to us so we can visualize how you do this? And forgive me for being so stupid about this, but I mean, do you actually birth the baby and then put the baby back in, or do you cut through the mother? How do you do this?
Well, there are three principal types of fetal therapy. First is putting in what are called little catheter shunts. That's done under ultrasound guidance. That involves putting a catheter shunt, say, for a fetus with urinary tract obstruction that can destroy the developing kidneys and lungs. That involves putting a double pigtail catheter. One end goes into the obstructed fetal bladder, and the other end goes into the amniotic space, and the shunt catheter bypasses the obstruction. And most of the amniotic fluid is fetal urine anyway, so then you can fix the obstruction after birth. So that's one category. Second category is fetoscopic surgery, involving putting a scope inside the uterus, and that's most commonly applied for us about 3 times a week to mothers carrying babies with identical twins who have twin-twin transfusion syndrome, such that identical twins, each in their own amniotic sac, but they only have one placental disc. The placenta is the hookup between the mother and the baby's umbilical cords. So usually a fetus has their own placenta, but in some cases of identical twins, it's a shared placenta that has to support both twins.
Wow.
Now, if there are abnormal crossing blood vessels from one side to the other, one twin may get too much blood and go into heart failure, and the other twin won't get enough blood and goes into kidney failure, and both will go on to die unless you put a fetoscope, a scope into the uterus, through the mother's abdominal wall, through the uterine wall, visualize the placenta, and then use a laser fiber to occlude or photocoagulate those culprit vessels to relieve the circulatory imbalance, and thereby save both twins in most cases.
Incredible.
The third category are big operations called open fetal surgery, where the mother goes to sleep under general anesthesia. Now, keep in mind that health-wise, she's sort of a medical innocent bystander. She's undergoing the operation to help her unborn baby.
Right.
The fetus has, say, spina bifida, where there is an absence of covering around the spinal cord that's being progressively damaged before birth by the amniotic fluid, which is mostly fetal urine and which is quite neurotoxic to the developing spinal cord, such that it ravages those nerves. The operation involves the abdomen being prepared. A sideways wound, like for a cesarean section, is made on her abdomen. The uterus is exposed. We use a uterine stapling device that we invented to make the cut in the uterus, and those absorbable staples pinch off the little blood vessels, or large blood vessels that are in the uterine wall, and it also staples the membranes up against the muscle layer of the uterus. The fetal back is exposed. The spina bifida is then closed to protect those delicate nerves from further damage. Then the uterus is closed, the abdomen is closed, and we give the mother powerful medications to keep her out of preterm labor. If we look at all of the nearly 300 or so fetal surgery for spina bifida we've done since 1998, the principal risk is preterm birth. Usually, on average, these babies are born 2 weeks prematurely.
That doesn't sound too bad, 2 weeks. Am I right about that? It's not too bad, 2 weeks?
It's not too bad if it's 2 weeks, but there are, rare cases where the baby is born very prematurely, which can be life-threatening. So that's on average.
So I'm guessing the mother doesn't feel anything, so she can't tell you there's something wrong. You must discover whatever's wrong in a normal checkup, right?
That's a good question. Usually, if there's good prenatal care, there's a maternal fetal ultrasound done at 18 to 20 weeks gestation, where term is 37 to 40 weeks. And usually the mothers go in with their obstetrician or maternal fetal medicine specialist to do a surveillance scan. Maybe the parents want to know the baby's gender, and they basically want to make sure things are okay. And so when things are not okay, then that can lead to panic and a quest for information about what options are.
Now, there's that horrendous thing that's going on. I think it starts with a Z. It attacks the fetus in the mother's womb, and then the baby is born with a small head. So the people, like in South America, the government is saying to the women, don't get pregnant for about 2 years so we can eradicate this. Can you help those babies?
No, that's caused by a virus carried by, that's mosquito-borne. The epicenter appears to be in Brazil. You're right, for those affected pregnant mothers who were bitten by that mosquito, their fetuses can have microcephaly, which is a small head, and that, of course, is not amenable to fetal surgery. The best way to treat that is to prevent it.
Oh, okay.
Oh, wow. Do you know, there's a campaign going on right now, too, and this it shows a 41-year-old woman, and she's holding on to a teddy bear, I think. And the mother of the 41-year-old woman, I assume she's 61 or whatever, she's basically saying, look, when I was pregnant with this woman, I was drinking all the time, and so the birth defects that she suffered, because the 41-year-old woman is like a 5-year-old child. The birth defects were completely caused, according to this ad, by the fact that the woman was a heavy drinker when she was pregnant. I'm guessing that's part of what this whole month is about, preventing birth defects?
Yes, but keep in mind, so that would be a case of fetal alcohol syndrome.
Yeah.
And the point is that in most cases, most birth defects, the cause is unknown, so it's mysterious. Mm-hmm. We don't know the cause, and that's why we need to do more research.
So I know you have a lot of interviews to do, and I wish we had more time to chat with you. Do you have a website that people go to, moms to be, dads to be?
Yeah.
You know, anybody who is interested, what's a good website to go to?
Well, your listeners can learn more about the Center for Fetal Diagnosis and Treatment and the Children's Hospital of Philadelphia, which is known as CHOP, at fetalsurgery.chop, CHOP.edu. So fetalsurgery.chop.edu.
Oh, wow. And by the way, we had a guest, and he was an author, and he brought his, was it a little boy who swallowed the marble?
Yes, little boy.
He brought him to the Children's Hospital of Philadelphia. He swallowed a marble. And brought his child to you guys, and you guys got the marble out.
Yeah.
And he said what's amazing? They have one of these every day. One marble a day. Mm-hmm. That's amazing. You guys must work with so many children. You probably see everything all the time.
We do. This past year, there were 26,000 operations done in children at CHOP.
Wow.
Oh, my gosh.
Thank you for doing what you do. How's the snow right now?
The snow is abundant. Would you like some?
You would think I wouldn't, but I would. I would love some. Yeah. Doctor, thank you for doing what you're doing and for educating us about this. And come back anytime, as always.
Thank you for having me on the show.
All right. Always good. We'll take a break. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Partly sunny Tuesday. There may be a shower along the coast. The high 69 at the coast to 74 inland. And mostly cloudy Tuesday night with a shower or